Well, a very good morning to you and a happy new year. And thank you for joining me to talk about the state of the DeBakey Heart and Vascular Center 2021. This is one of the few times of the year where we actually look horizontally across the Heart and Vascular Center. We typically focus on EP, cardiac surgery, for example. And one of the reasons this is an exciting presentation is because it gives everybody in the Heart and Vascular Center an opportunity to look and see what their colleagues are doing, what the exciting things are that occur amongst the nearly 200 people who are part of this Heart and Vascular Center now. The title slide, which I'm using, says the state of the Heart and Vascular Center in 2021. But this is changing. And it's changing because the main theme that you're going to hear today is really about the system. And the fact basically that we are moving from a downtown-based Heart and Vascular Center to a system-wide approach involving all of our sister hospitals. And so perhaps we need to change this next year and refer to this as the state of the Heart and Vascular System 2021, because that's where a lot of the exciting developments are going to come from. What we've done is establish physician membership criteria, and I'm really excited that over 200 people have applied for this, and so we now have a network of physicians, over 200 strong, who will work to expand basically the mission of the Methodist DeBakey Heart and Vascular Center in the future. So since we've expanded this, I think it's worthwhile going back to talk about our vision statement. Let me reiterate it. The DeBakey Heart and Vascular Center aspires to be a nationally recognized leader in the delivery of quality cardiovascular care, with a commitment to research, teaching, and innovation. We often talk about the three-legged stool of academia, but clearly one of those in our system is a bigger leg than the others, and that is the clinical care component for it. If we get that wrong, the rest of it really is irrelevant. If we get it right, then it helps raise the education and raise the research and the innovation to a whole different level. So I'm going to talk a little bit about some of the accomplishments which have been achieved this year. Nationally, we are ranked number 12 in the nation in cardiology and cardiovascular surgery. That is one of the highest rankings that we've ever achieved. We're clearly a leader in cardiovascular education. I come to you today from the DeBakey CV Live studios, and this studio has come to epitomize cardiovascular education in our Heart and Vascular Center, both locally and nationally. We're planning to continue the clinical program expansion. I'm going to focus shortly on TAVR because it's probably first out of the box in terms of expanding some of these complex systems nationwide. We're going to follow this up with an aortic network program. In addition to it, we'll continue to focus on the bread and butter, which is quality and safety. And we're doing this by integrating a number of the registries across the system, by creating system-based protocols for example, TAVR, delineation of privileges, imaging, standardization of cardiac surgery, patient and nurse education collaterals. So we're always looking for the opportunity by which we can standardize, centralize, and move across the system, so we're all approaching this with the same approach to pre-op, post-op care, or wellness and prevention programs. And we're going to focus on a lot of these. So again, just to focus on this, because it's something that we're obviously very proud of. Ranked 12th for cardiology and heart surgery nationally. The rankings for US News and World Report are based upon patient outcomes, quality of care, patient experience, which is the majority of the points which we achieve. Hospital reputation accounts for about a quarter of the points, and that's a very semi-quantitative at best measurement. And it's one of the reasons that we're so focused basically on our education programs and distinctive research programs, because this is not something you can easily influence locally. It has to be a national thrust in order to be able to do that. The hospital was ranked number 1 in Texas again, and we are ranked number 12th obviously in the nation. We were mentioned for very high performing areas in heart failure, abdominal aortic aneurysm repair, aortic valve surgery, heart bypass surgery, and then TAVR. And TAVR is going to be increasingly important in these national rankings because the outcomes from TAVR are going to be included in these rankings going forward. If we look, I want to focus on our TAVR program for a moment as an example of how we're starting to move this expertise really across the system. Let's start off by looking at how US News and World Report will include TAVR moving forward. So the rating is going to be factored into the calculation of the best regional hospitals, that's our system hospitals, and the honor roll rankings, which obviously will affect the hospital. We were in the honor roll this year as Houston Methodist Hospital. These are the top 20 hospitals in the United States. These rankings for TAVR will also have a new risk-adjusted outcome measure for stroke within 30 days, an area in which we've struggled a little bit in decreasing the strokes. So there'll be an increase in focus on that going forward. And these reports will be publicly released alongside the rankings. If you compare us with our three major competitors downtown, I want to show you that we were high performing, excellent, and very high in terms of volume ratings. We were distinguished in the survival rating from the other two centers, and that's really very important. You can see the way these scorecards are reported on your right here, and we're almost green across the board. Still got some work to do on prevention of stroke and readmission prevention, but we are way ahead basically of our major competitors. So TAVR, of course, has gone from being a research protocol to more widely clinically applied, and now, as it was approved by the FDA, broadening out the delivery into the periphery. And so this is kind of the approach that has been taken. I got to give thanks to Dr. Little, Dr. Mike Reardon, and should have added Dr. Neil Kleiman, who's played a very important role in this, in helping to, number one, establish the program down here, establish the worldwide reputation for this program down here, and now as it's commercialized, is helping to maintain the quality as we start rolling it out. And the sequence for that is establish the valve clinic, then establish basically the TAVR program. And you can see one of the first valve program marketing offerings on the left, in which it shows all of these different sites across the Methodist system. So my eternal thanks to the people who put in all the work to try and roll this out. I'm going to look at each of the different TAVR sites. If we start downtown, I want to say welcome to Dr. Sachin Goel. He replaced Dr. Colin Barker and is a very able replacement. The downtown TAVR team is approaching 2,000 TAVRs, and that's included 500 clinical trial TAVRs. When I go on to talk about education and innovation, I'm going to revisit TAVR as an example of how important it is that institutions like ours are involved early on in these transformational technologies, and how it drives the clinical operation, the research operation, and the education operation down the line. So keep that in mind, we'll come back to it. These system goals, and in each of these different subspecialty services, we're going to talk about system goals. And the system goals for the structural heart groups are to align the cardiac imaging for structural heart, create standard echo templates, CT and MR templates, continue with this clinical expansion and marketing, drive in patients where appropriate to the individual centers. That's how the marketing is going to be structured, and they will be driven to those people who are members of the Methodist DeBakey Heart and Vascular Center. That's one of the values and membership of the Methodist DeBakey Heart and Vascular Center. And we're starting to explore how these clinical trials not just have to happen downtown, but what is the infrastructure that we need in order to be able to run trials across our system. That would make it very powerful and increasingly appealing for companies to involve us in these clinical trials. But as I've said, this is rapidly in evolution. And the Houston Methodist Sugarland was the first site that came up and started implanting TAVRs. And you can see the cardiologists and the surgeons have worked diligently together, and this has resulted in more than double the yearly rolling aortic valve replacement volume. And the two surgeons, Marvin Atkins, has been there for a while, and Dr. Moritz Weiler von Bolmus basically has joined that group. And you can see this is the cardiology group led by Keith Ellis, Dr. Koo, basically, and Dr. See if I can screw this on, Wick Rismingen. I apologize if I screwed that up. I was trying to avoid even mentioning the names to start with. But it's also expanded out at West, and you can see basically the two groups, the surgeon, the cardiologist, Dr. Daya and Dr. Lafuente. The clinic opened November 6th. They've done their first TAVRs in September 14th, 2020, and they've really had excellent outcomes. And so we continue basically with this expansion. Next up, and I believe these first cases are going to be done today. And so again, thank you really for the group who have helped put that thing together. There's been a remarkable collaboration from the surgical side, because they've got to achieve a certain number of surgical valves in order to be able to establish that. And Cliff Kitten has been very helpful in referring many of the patients that would otherwise have been done at Willowbrook up to Woodlands to try and establish those numbers. And the plan is, once the TAVR program is up and done, it's up and running, that Woodlands will reciprocate in shoring up the surgical valve volume at Willowbrook, so that they basically will be one of the next stops. And if you stand out to Methodist at Baytown, the valve clinic basically has now been established, and you can see the people who are actually helping to do this, and they're preparing. The valve clinic should start basically early next year, and hopefully later in the year perhaps the TAVR program should be established. So this is an example of how we are looking to expand these services beyond the medical center and out into the community, but at the same time making sure that the quality basically is maintained, aligning this with marketing so that we actually continue to drive volumes to the sites that we are interested in, who are part of our Methodist DeBakey heart and vascular system. Again, the marketing will be regionally based in the areas that support those individual valve programs. So what are the Center of Excellence? We, the Heart and Vascular Center, is a Center of Excellence at Methodist, along with, for example, cancer, orthopedics, transplant, or other areas of centers of excellence. We're probably the one that's best well known, and what we're trying to do is to become a leader in cardiovascular value-based care, to develop and maintain these distinctive clinical programs, to improve patient referral and patient retention inside our system, not something that we've been particularly effective at in the past. We want to strengthen and grow the physician network. You are the physician network, and this network comprises cardiologists, CV surgeons, CV critical care docs, CV anesthesiologists, and it also involves those researchers who are involved in the cardiovascular enterprise. Obviously, that is primarily downtown. And we have created a new governance model, and I'll spend a little bit of time talking about that. We feel it is incredibly important that those of you who are in the periphery feel represented and empowered to influence the decisions that are being made, across our system. We strongly believe that this system will live and die based upon our ability to encourage you to want to be part of the system, for you to see value in it, and for you to see that your voice is heard in terms of the decisions which are going to be made, which will affect all of us. And so our strategic priorities are growth. We want to grow this business, the cardiovascular business, across the system. We'll show you from some of the marketing data that we're really the preferred provider, but we want to see volume growth occurring as a result of that. We want to continue to deliver value with excellence in delivering high-value patient-centered care, maintaining quality, growing our talent, and at the end of the day, this whole process depends upon attracting the best and the brightest, but retaining the best and the brightest. And by creating basically the kind of environment that we've experienced downtown and moving that out into the periphery, creating some of these exciting opportunities, we think that will help us retain the talent that we recruit. And we want to develop the next generation of network. Over 200 physicians. This is a big cardiovascular network. We need to take it from concept, and there are so many people I need to thank for doing that. Dr. Miguel Quinones and I were working on this. We've been working on this for years, in all honesty, but it's really taken, it's now happened, and I've got to thank many people who have essentially helped to make this happen. Jordan Gion, Sam Poe really carried the water for this, going around the system, and Debbie Sukin is the system CEO who's going to be responsible for the Heart and Vascular Center, and Dr. Zogby has been instrumental alongside me in trying to create these matrices. They may not be perfect, and we're certainly willing to discuss these at the executive committee level going forward. So this is the governance structure, and the executive committee for the Methodist DeBakey Heart and Vascular System. It has representatives from all of the different hospitals, as you can see here. Our plan is to create these subcommittees. The subcommittee for membership has been created. They're the ones who are vetting the applicants so far. What you can see is on the left of the screen really is the list of the subcommittee. It's going to be chaired by Dr. Zogby and myself, but it's got representatives from Sugar Land, West, essentially from all of our system hospitals. We also have some of the administrators that are very important to us, Debbie Sukin and Mick Cantu, who are the system CEOs over the North and the South region. And from downtown, Roberta Schwartz, who's the CEO for Methodist, Michael Garcia, who's the Executive Vice President, and Brenda Campbell, who's the VP for the Heart and Vascular Centre. The job of that executive committee is to create the direction, and some of those directions you can see on the right side or your left side of this pyramid. The physician membership has been launched. We announced that just about 2 months ago, and those criteria were established. As we move forward, we want to get involved in the purchasing of equipment for the Heart and Vascular Centre. Obviously, that's going to require negotiation across the system. You can see some of the system initiatives for clinical care organizations, which are being created. We have purchased VQI, which is the Peripheral Vascular Registry. It's as audited as our cardiac surgeons are and our coronary interventionalists are. There's almost no method really of auditing what has been done in the peripheral vascular world. We think it's time to change that, and we've purchased this VQI, and we'll be rolling this out. We're going to roll it out with the carotid registry. The plan is to expand that later in the year. We're developing, as I mentioned, an aortic network with some of its own databases to try and capture the data and to drive the research and the presentation program. And we're developing, as this whole program evolves, we think we're going to be able to expand our training programs at residency level, fellowship level, really across the system. And almost, if we get all of these hospitals involved, we can almost double the number of trainees that we actually house here. So these are some of the priorities that have been laid out as we move out into 2021. Now let's talk about clinical program development and expansion. These are the programs that we're really looking to drive, programs that drive strategic growth. Heart failure transplant, I don't need to read that list for you. This may change, and it may change on an annual basis, depending upon technology that comes along, change based on reimbursement, for example. Others that require basically comprehensive programs, obviously there's some very advanced imaging, which has largely been based down here. Increasingly we can see that basically being moved out. Prevention and wellness I'll focus on a little bit later because it's one of the newer, very exciting programs that we have. And then there are others that we think complement the core programs that really already exist. So the way marketing really has functioned is that the Houston metropolitan area has been divided up into different regions according to which hospital is centered within them. Marketing has largely been done by individual institutions. As part, now that we have membership criteria, we've established an official network. The plan basically is to choose basically what the areas of focus are for marketing, to drive that basically across the system. And the results of that and the referrals will be driven to this over 200 members who are now part of this Methodist DeBakey Heart and Vascular Centre. Again, it's not that you can't work in these Methodist hospitals. We are an open staff model, but there are certain higher level criteria that we have created for you to become a member of the Methodist DeBakey Heart and Vascular Centre. And only those members will receive the referrals that are coming in and being driven by marketing. And so we are broadening this brand of Houston Methodist DeBakey Heart and Vascular Centre. Until now has existed downtown. Now we basically, that shingle can be used in all of the system hospitals, and we would encourage you when we get these white coats made, we would like to see that basically on your white coats. Those 200 people are now members of the Methodist DeBakey Heart and Vascular Centre. That will be the brand moving forward, and that is what represents the cardiovascular enterprise at Houston Methodist. And so the idea by creating this membership is that as we move forward to increasing the bonds that tie us to one another and to Methodists in particular. What we're really trying to do is create a group of dedicated physicians who see Methodists as their home and Methodists as their future, and to try and provide you with the kind of value that you see in aligning specific with us. So we've created the alignment and the structure. We have certain quality matrices. The idea will be we will hold one another accountable for delivering the high value care. We're developing these joint teams. As an example, we've shown you as TAVR. These bridges are being created between downtown and the community, and we're going to connect the patients into this, what we think is going to be one of the best cardiovascular care networks in the nation. So lofty goals, but I think are eminently achievable. When I look back and see where Methodist has come from to where we are at the moment, again, I often go back in this presentation to the divorce which occurred from Baylor. Overnight, no medical students, no residents, no fellows, no IRB, no way of employing a doctor. At that time, these goals, many of the things that have been achieved seemed incredibly ambitious. Many of us thought crazy and unachievable. And so for the first, I'd say 10 years, the focus was on, I call it rebaking the downtown cake. The cake is baked. Yeah, we're going to have to put some icing on top of that cake every now and again. But now we're really trying to make a bigger cake, and that's really what this is all about. And so as challenging as it seemed to recreate Methodist as an academic organization, this is not nearly as challenging. The infrastructure in all our different institutions is phenomenal. I have to compliment the administration and leadership who has brought us to this point, created this platform, both in terms of the infrastructure and also in terms basically of the financial integrity of this organization that will allow us to take the Methodist DeBakey Heart and Vascular Center to the next level. And so that's a challenge that I throw out to all of you, is that we don't want you to be passengers. We want you to be active participants. If you disagree, we want to hear about it. We may argue about it, but at the end of the day, I think we are stronger if we come together and we set this vision for what I think is going to be the greatest cardiovascular network in the United States. The platform is, the table's been set, and now we actually basically got to go ahead and implement it. There are a whole number of physicians, and I'm sure this is not complete, of people who have joined the service this year. Many of these people are in the PO, but increasingly you're going to find patients basically who are beyond the PO, the physicians organization, and the strength of this organization will be reflected in how many people from private practice want to join and be part really of what we're actually doing, because they're excited about the vision really for the future. So let me now segue into various different components of the Heart and Vascular Center. And I want to talk really about the Center for Critical Care that was created. I have to really compliment Dr. Faisal Masood. He is a member of the Methodist DeBakey Heart and Vascular Center. He became the first director of the Methodist Center for Critical Care. Another example of how we're starting to look horizontally across the organization. Faisal ran our cardiovascular surgery ICU. He's a friend and colleague and managed that very well. We're a little afraid when he took this bigger job, but I can tell you he's continued to be involved, and his replacements have really done just a tremendous job. And so there are many achievements for the Center for Critical Care that have been achieved this year. These are the number of ICU beds in the cardiovascular world has increased to 66. They turned on the virtual ICU, a little controversial, but I tell you, when faced with COVID, this was a remarkable support mechanism that was turned on very rapidly. They've helped with multiple protocols, particularly ECMO. I'm going to come back and talk about ECMO because this has been something that has been stretched this year because of COVID. And we rank 8 out of 91 in the percent deaths observed on ECMO. So the ECMO program really has and I'll mention Dr. Suarez a little bit later. And the CV ICU critical care faculty received multiple awards. Let's talk about marketing a little bit. And so what this represents, a little confusing. If you look basically at light blue, and let's start on looking on your right, where the 32% is. This is the consumer preference. In other words, if you go out in the community and say, where's the best place to go for your cardiovascular care? This is what they're going to say. Now, you can see that we've come a long way, that we have continued to ascend. We've ascended way above our competitors. We are continuing to rise. Some of our competitors are actually going down. And at the present time, volume, we are the preferred provider. Now that doesn't mean we have the biggest volumes. There is a gap between preference and actually being able to come here, a gap that we'd like to see closed. I often say you can't eat fame, and so we got to basically convert the fame into the actual number of patients who are coming through the doors. But we think by attacking this as a system and this system-wide marketing approach that we're about to embark on, then hopefully we can make sure that the volume pursues that. And this is why, if you look basically, that was what I showed you before was all-comers preference. If you look at commercial preference, then again you can see that we are the highest basically of the group and continuing to increase. And that's a very exciting trend. Likewise, if you break it basically down into bar charts, you can see that our commercial insurance, our commercial preference and our overall preference continues to increase. So how are we going to market this? Again, there are a number of different campaigns. These campaigns are decided upon based upon, what is the need, what is the value, what is the amount of commercial insurance that occurs in each of these groups. And you can see that AFib is one of the areas of focus. Adult congenital heart is another area of focus. And one of the things that we focused on last year was your heart can't wait. We really were focused on trying to make sure that patients who needed our services were not afraid of coming into the hospital. But as we move forward, we can see that this DeBakey system campaign will happen across 7 locations. And so what you will actually start seeing each of your different hospitals in this print ads, increasingly electronic ads and social media ads that will help to drive these patients not to downtown but to each of these individual markets. And that's going to be very important that we track the effectiveness basically as we go forward. Again, these are all specific for each of your different hospitals, and it will drive these patients into the DeBakey system homepage. Please make sure that the description in your profiles is up to date and that the areas of interest are accurate. What we don't want is patients being referred to somebody who says they want to do, for example, in my world, thoracic aortic aneurysms and they can't do it. That will not basically, is not the way we really want to do this. We want to try and make sure we get the right patient to the right provider with the right interest. And so all of this traffic is going to be driven to that DeBakey homepage, and it's very important that your profiles are really accurate and reflect really what you're actually offering. Increasingly, of course, we depend upon social media, and we expose cardiologists and CV surgeons with this Houston Methodist messaging campaign through a national reputation campaign. Obviously, there are 2 different components to this. There is what we do locally to drive patients into our individual hospitals, and then how we're beginning to function increasingly nationally to try and influence that reputational score. And a lot of that has got to be done really with electronic media. A lot of that has been done with the kind of educational offerings. It is very difficult. I'm sure you've all had this experience trying to explain to colleagues around the country what the exciting things are that exist in Houston Methodist. Particularly for those of us downtown, we live in a very complex environment. We are immediately adjacent to and connected to our competitors, and we live in a place called Texas Medical Center, which a lot of folks around the nation think is a hospital. And so it's very difficult to try and explain what Houston Methodist is. But once they've been here, once they've walked the halls, once they've met our faculty, once they've seen our resources, they get it. And so that is one of the reasons that we've been so focused on education. It's one of the reasons that under Bill Zogby's leadership, we actually changed from mainly internal speakers at the DeBakey Heart and Vascular Center to actually inviting a who's who in the cardiovascular world, because we want these people to come down here to see us and to meet with us and be our ambassadors and go out and tell people about the great things that are being done here. Now, obviously, we have been denied that really for the past close on 12 months, probably for the next 4 to 6 months. But I'm coming to you from this DeBakey CV live studio. Maybe now's the time you guys can pan out and show them around the studio, because this has become basically what the world sees in the DeBakey, from DeBakey Education at the moment, and that is this studio. This studio is not mine. This studio is ours. We use this to produce a number of different products. We do CV Live, which is live video casts. We have CV Now, which is a podcast series which are being collected. And I would ask all of you who are participants in this network to think of ways that we can use the studio to try and improve basically our reputational score nationally. And we'll come back to DeBakey Education. Let me go back a little bit to CV Anesthesia and Critical Care. Dr. Steadman was recruited here as the chair this year of Anesthesia and really has done a remarkable job under the most trying of circumstances. Dr. Steadman arrived here, COVID hit, Critical Care had to be completely reorganized, so welcome Dr. Steadman. It's been great working with you and look forward to increasingly work with your CV anesthesiologists and Critical Care group moving forward. That group, particularly the intensivists, have faced the challenge of a lifetime. And again, with Dr. Steadman and Dr. Masood's leadership, done a remarkable job in terms of providing intubation teams, line teams, running our ICUs, and we look to see the anesthesia group continue to grow in the future, and the plans to start basically a residency program. Again, Dr. Masood has taken over basically the Centre for Critical Care, but he continues to be part of the Heart and Vascular Centre. We're going to keep you here, Faisal, and claim you as your fame increases. So you can see there's got an enormous amount of exposure this year because of many of the unique things that have been done around COVID, and I'll touch on that really a little bit later. They've created a critical care symposium, a number of different research projects basically are going on. They're collaborating basically with Texas A&M, and thank you really for all the efforts. One of the biggest groups in the Heart and Vascular Centre, and who carry almost the biggest patient load, are the group that deals with advanced heart failure. We've expanded this year in the number of cardiologists who've been added to this group. I'm delighted to see our colleagues from Texas Heart being incorporated into this heart failure, this advanced heart failure group. We've also added a face up there nobody would recognize is Dr. Philip Chow. He's next to Tom McGilvery there, and he's been recruited as a transplant surgeon. Will actually arrive next month and will actually shore up what has been a highly stressed group of people. These are amongst the hardest working group of people collectively in the hospital. And you can see all of the different initiatives that they have created. Can't really go into all of these different initiatives, but we'll focus really on some of those. The heart transplant program rolls up under this group. We did 56 heart transplants this year, but what's been remarkable is the number of multi-organ donor transplants that have been created. And so it's one of the highest dual organ transplant programs in the United States and one of the largest cardiac amyloid transplant programs. And that's because the amyloid clinics were being created to try and capture those patients. And I'm delighted to say that the outcomes for the heart transplant program have been, the transplant program, thoracic transplant program in general, have been absolutely phenomenal. And the number of VADs that we've done this year, which we see as a real opportunity for growth here, has been only about 41 this year. We'd like to see that increase is going to be an area of focus for next year. If you look at the research highlights, you can see all the different groups basically and what they had been working on. On the bottom left is the Translational Research Initiative. This is an example of one of the unique things about our organization. And the Translational Research Initiative is created for physicians, not just cardiovascular physicians, but we have two groups, basically Ash Guha, and you can see in that group is also Steve Little and Steve Eigel. They both got translational research initiatives, which have allowed us to try and take essentially preclinical concepts and move them up into the clinical environment. And for the two Steves, this is really mitral mimics. It's a new mitral valve prosthesis, which is actually moving along very nicely. And you can see basically some of how the foundation has been excellent in collaborating with us and creating support for these various different programs here. There is an expanding, and I'll come back and talk a little bit about NMED a little bit later. This is the opportunity of a lifetime for those of us who are interested in innovation and research. Obviously NMED is a collaboration with Texas A&M University, and I'm really grateful to see the number of cardiovascular clinicians who have engaged with this. Dr. Hussein's kind of taken the lead on creating some of this training, along with Dr. Swami, basically from our group, who's really helped teach many many of these classes and engaged them in creating a ventilator. For COVID patients, we'll talk a little bit about that later. And you can see a TAMU grant, this Presidential Clinical Research Partnership, funds 6 different research projects, of which we're a significant part. And so NMED, bottom left, you can see is training. The word that has been used basically is physicianeers, physician engineers. They got to be an engineer to be admitted into that medical school and move this forward. And now this program also is expanding really out into Baytown. And thank you very much, basically, for taking the lead on that. You can see some of the cardiovascular surgery highlights. For the first time ever, we hit STS 3 stars, and that Tom McGilvery is responsible for that. Our surgeons stepped up to the plate when our intensivists were pulled, and our cardiac surgeons were the in-house intensivists. Hopefully we're not going to have to revisit that. Ross Rowe's got the Cardiac Thoracic Surgery Fellowship starts this year. We've created system hospital peer review under the auspices of Dr. Ramchandani, and you can see the cardiac surgery projects. PERT program, Pulmonary Embolism Response Team concept. Here's an example of something that was created in the periphery by our partner Thomas Lowe, really working with Paul Cunningham up in the Woodlands. They drove this, and we basically are following a lot of the things they do, and Chara Bavari has taken the lead really for downtown for actually creating this. But I want to single out one of the quiet, unsung heroes here has been Eddie Suarez. And Eddie is one of these guys who just does the job. We have been inundated this year with patients with COVID who needed ECMO. And you can see that Eddie almost single-handedly basically has taken on cannulating these patients and monitoring these patients. And so done it under very difficult circumstances and done it with remarkably good outcomes. You can see that 4 or 5 years ago, we weren't doing so well in the ECMO business. And I think this is a function of the leadership of the CV world, of focusing on the indications, patient selection, and optimal management, and Eddie has played a remarkable role in this. So you don't get many accolades a lot of the time, Eddie, because you're just the quiet man who does the job, but thank you really for what you've contributed to this year. Moving on to the EP world, of course the highlight of the year really was Miguel Valderrabano. It makes me cringe to think of writing another NIH grant, but he did it. Writing an NIH grant which involves multiple different centers, but he did it. And then executing on this to the point that this is a huge publication that happened that occurred. It's called the Venus Randomized Trial, and a major presentation under his leadership. It is a daunting task to take this on and to bring this to fruition. So congratulations, Miguel. I take my hat off to you and thank you for featuring the Heart and Vascular Center. Again, the EP group is expanding really across the system. You can see the people that they've added. They're planning to create an inherited arrhythmia clinic. You can see some of the names. I'm not going to try and screw these up also. And Francisco Altamarno has also been recruited as a PhD to help supervise the many projects that are going on in the basic science lab. So welcome. And again, this not only basically are they're truly the triple threat. These are the high quality publications that have really come out of that group. So, and congratulations also on creating this 2-year ACGME accredited program, which has been done with a combination of GME support, industry and philanthropy to actually fund this, and how they've expanded these teaching sites basically around the community. One of the real stars for this year is the creation basically of the Prevention and Wellness Program under Karam Nasir, and this is really what their mission is. Again, clinical research and education. What they want to do is put us all out of business, I guess, is one way of thinking about it. They want to reduce the risk. And goodness knows this is an area that we have badly needed to add to the Heart and Vascular Center. So thank you, Dr. Zogby, for recruiting Karam, and thank you, Karam, for recruiting the people who support you in this. You can see how their clinic volumes have gone up. New patients and follow-up patients have continued to increase. And if you all have patients who need aggressive management of their risk factors, I know almost everyone in the vascular surgery clinic needs this, then please send them towards this group. Not only, of course, are they doing this, but they've also continued to publish. Karam, we actually have a seat here named after Dr. Nasir because he's been in the studio so many times this year and has been featured. And so he's very eloquent and not only is he interested in prevention of wellness, but he has a joint appointment in the Center for Outcomes Research because he's a big data guy, and that's really what this last slide represents, is the increasing interest in big data analysis. How do we accumulate it? How do we optimally use it? And how do we use that to improve the outcomes really for our patients? So thank you, Karam. Remarkable job in a small period of time. Adult congenital heart we mentioned earlier, as we tried to grow this with the marketing group, and you can see that it increased fairly rapidly. Again, it's been slowed down this year, as you can imagine. The number of surgeries also slowed down, but we want to go back to that upslope in the curve that was actually occurring here. Huey Lynn basically, of course, taking the lead along with Tom McGilvery in this. One of the interesting productions this year was the first Houston Methodist Congenital Heart Awareness Week. Why? Inside the system, because it affects about 1% live births. We employ basically over 47,000 people. We need basically to start taking care of our community. Again, you can see the studio featured. We got Bill and Huey with this Congenital Heart Awareness Week, which of course we broadcast and make available externally. And Huey also is one of these social media masters, and you can see what the kind of exposure that program basically actually got. They focus really on patient-centered education. It's one of the kind of unique symposium that we run, is where we bring the physicians and the patients together. I think there's a very motivated group of patients who have complex adult congenital heart disease because of the number of times that they interact with healthcare professionals. And so we've encouraged the development of patients as educators. You can see the flyer that occurred when we had this Adult Congenital Heart Symposium on November 7th of this year, all obviously done virtually. Hopefully towards the end of this year, we might get back to having an in-person meeting. I think the last 2 to 3 months of this year it's going to be a busy time because almost every regionally, nationally, and internally are moving all their symposium to the last 3 months of this year. So may need a little bit of sorting out. And our focus of the symposium and CV Live is empowering patients and families with actionable knowledge from knowledgeable patients. CV Live is the name that we give to the productions occurring out of the studio. About 4 nights a week we're actually producing something. It was the first time we featured an adult congenital heart patient, successful heart transplant recipient, who's also a cardiology nurse practitioner. So thank you, Huey, for doing this. Valeria, and I've earlier published this paper, Dr. Duarte, on the impact of pregnancy and ventricular strain basically in women. And Dr. Duarte basically is the second adult congenital heart cardiologist who's really been added to this group. And we expect to see this continue to grow in importance and scale across the system. There are a few accolades basically I'd like to give. One's to our own Dr. Solomon, who is the president of the medical staff here at Houston Methodist. Congratulations, Stuart. Big weight on your shoulders. Dr. O'Hara, one of the CV surgeons, president of the Baytown medical staff. And the two Katz scholars, Mr. Katz basically created an endowment to try and support clinician scientists. Dr. Karam Nasir was the first person in the Heart and Vascular Center who got that. This gives protected time. And we just recruited Dr. Tricia Roy, who's going to start working on MR-guided peripheral vascular interventions and leverage the power of the 7T magnet down in the Translational Research Imaging Center. So accolades really to those folks. We are represented very well across the country in terms of national society positions. I'm not going to read each one of these, but I think this shows the strength of the academics in this organization. I often show this slide because I think one of the things I'm most proud of are the resources that we have at Methodist. And when you go into our system hospitals, they are all absolutely superb organizations. And we all want you to leverage some of the things that are available downtown for research and education. The studio is an example of this. I believe, and this is the way I pitch this to people, is that we have built the most advanced cardiovascular clinical care center that exists in the world. Now we've been in it for a year and a half. It's pretty hard to believe. It is immediately adjacent to and mighty to the most advanced training center that's been created anywhere. Because of the Siemens relationship and the Translational Imaging Center, the whole thing and the whole cardiovascular enterprise is overlaid with the most advanced cardiovascular imaging that exists in the world. And And this is one of the things that I really want to emphasize for the community, is that as we built that tower, we built in the audiovisual integration. We can turn on cameras in the cath labs. We can broadcast these cases. And what this does is it helps us create the most extensive video library that exists anywhere in the world, and it lets us show beyond the walls of this institution the kind of magical stuff that is being done by the people who are here. If we build that same integration into the system, then it just magnifies exponentially the power that we have in showing the world what is going on here. And so I believe that one of the advantages here that we have downtown is the proximity to this. A lot of places have pieces. Very few places have it on one campus that allows folks to come in, do training in Mighty, interact with their physicians, walk over to Basie and see our operating rooms, for example. And the other part of this is this NMED program. Again, Rod Pettigrew is a cardiologist who I knew at Emory, went up to the NIH, ran one of the imaging divisions up there, and is now the Dean for NMED. And so, Rod, you're doing a great job, and really thank you for taking this on. We also continue to think of you as a member of this expanded Heart and Vascular Center, and we really look forward as the first year class is completed and as they start coming into these clinical rotations. Please embrace these students. Grab them, get them interested in the cardiovascular world. We got some competition amongst the other centers of excellence, but nowhere is as exciting as the cardiovascular enterprise at the moment. Let me move on for the last 15 minutes to talk about DeBakey CV Education. I took a role in the leadership of Mighty. I'm now the medical director of Mighty, and so DeBakey Education and Mighty is increasingly kind of basically interdigitating with one another. And you can help us with this because we want more and more training and education. One of the things that's been missing in Mighty is internal utilization, and that's probably because of the cost structure. And we're working on trying to find ways by which we can provide what I call Mighty dollars that could be given to, for example, Dr. Zogby, so that whenever he wants to use Mighty for training the residents and fellows, first question is not, well, where are you going to find the money to do it? And this is an area that we're focusing on for Mighty to try and engage the peripheral hospitals. We even talked about having mobile Mighty that we can actually bring out to you so that you can also take advantage of the resources that exist down here. Now let me take a step back here and talk about the power of all of these resources that we have. And I'm going to use TAVR as an example. When Edwards came out with their TAVR, we wanted to be part of it. We did not do a good job in representing ourselves in that. We were not involved in that trial. A big miss. And then Medtronic came along, and we were part of that Medtronic core valve trial. And this is where Mike and Neil stepped up, and they were tremendous leaders of this. We were amongst the highest enrolling, highest enrolling in the country. Now, what does that mean? That means it created visibility for us. And so Dr. Reardon became the national PI, national and international PI, on several of the subsequent trials. Now, what does that mean? That means that you have your hands on the data, that you are the principal or senior author as the publications come out, and only about 5 in the New England Journal of Medicine. You can't buy that kind of marketing. And then what happens is it gets commercialized. Now, because industry had been engaged with us, they'd seen Mighty, they'd seen our facility. Well, for example, Medtronic brought 60 cardiologists and surgeons, parked them in our auditorium, allowed them to watch our cases, allowed them to walk in through the halls of our organization. Again, you can't buy that kind of marketing. And as the training programs roll out, guess where a lot of that is taking place? In Mighty. And so this life cycle of being involved in cutting edge technology, it drives our reputation. We get the publications out of it. We drive Mighty because these industry companies come back here to do their training. All of this thing basically works out to the advantage of the Heart and Vascular Center, and very few people have this linearly set up like that. And to add on top of this, we've created what we call the Center for Rapid Device Translation, so that we don't just need to depend on the Medtronics of this world. We're increasingly going to the startups and trying to bring them here. And so I'm not going to go through all of this because I'm getting a little short in time here, but this has allowed us, these kind of educational activities that we have here, the studio, these online offerings, and these training programs that we've got. This is the boot camp being featured in methodology. This really kind of was the biggest thing that we run. Very complex, trying trying to run hands-on training for 150 people. This year we had to make it virtual. The advantage was we were set up to do that and allowed us to increase the number of people who were exposed to it. We were denied the hands-on participation this year, or were we? We actually ran an experiment with incoming vascular residents in which we distributed 50 hands-on kits, stands for iPhones, and so we actually had faculty here watching them actually operate and do procedures basically around the country. And so we're obviously very interested in innovation. Our YouTube channel is over 5 million views. We'll hit 40,000 subscribers. That is 40,000 people who get told every time we post something, who have agreed to be told every time we post something. And the CV Now probably has not had as much exposure, but certainly worthwhile listening. You can go to the Apple Store, download CV Now and listen to it through your app. The journal under Dr. Quinones' leadership continues basically to expand we're going to switch this year to online only, except if you actually request it. There's a huge expense in actually publishing these, about $250,000. We think that money could be better spent elsewhere, but if you really want a hands-on copy, then let us know and we'll actually get it to you. One of the new initiatives at MIghty / the Heart and Vascular Center is to create what we call the Robotics, Imaging and Navigation Center. Again, we're trying to align the research endeavor with hospital areas of excellence. And robotics is rapidly emerging across in cardiology and also the surgical specialties. And we want to build a research program that will support this. And Dr. Stuart Corr, who's the Director of Innovation Systems Engineering, also part basically of our department, is basically going to lead that. Let me show you just a couple of examples of we're trying to change our educational offerings, because we're moving into the virtual reality, it's the VR, augmented reality, we'll show you examples of this, and now we're building MIghty extended reality, and I'm going to show you one component basically of this.
Of the room. As we look around, we see that there are an initial 15 cardiovascular topics to select on the main screen. These topics range from award-winning animations depicting cardiovascular conditions, treatments, and drugs, as well as surgical video footage of actual patients. Next, let's teleport to the left. Outside the window, you will see the Houston Medical Center, and on the right, you can see where the MIghty Center is located. You will feel that you're on the 14th floor of a brand new tower that has been built in the middle of the medical center.
So we hope to have that running by later this year so that we can bring people in virtually. Oculus Quest is the kind of new heads-up display that you're going to use for this. And this is just another example of how working with industry are starting to develop these remote training programs. You can teleport in. A proctor doesn't need to be there, and we're trying to position MIghty and the Heart and Vascular Center as the place that industry should come to be involved in this. Just one final example of mixed reality.
Shadow casting there again, and now again with UltraLeap we can even interact with these virtual models. Now in this case, Jussi is bringing the heart of this vascular.
So again, new way, but actually I'm going to go on through this because I'm running a little bit out of time here. And I want to finish off, basically, we talked a little bit about some of the innovation and then move on to close with research. So the COVID innovation, you've all stepped up. There's examples basically of Swami building his ventilator. We can see basically Sachin actually took what we'd already created, in the hybrid room for remote proctoring. What he did a great job of was publishing one of the first cases because the proctor couldn't come in because of COVID. And you can see basically Dr. Masood here building and working on a shield which we're trying to protect the respiratory therapists and the pulmonologists when they're doing basic intubation. So in the last 6 minutes, let me switch over to research, because the research is incredibly important to us. When John Cook arrived here, he imported the Stanford model of creating research affinity groups, self-assembled groups that focus, as we've seen, around EP, heart failure, vascular. John's group now has like 53 independent research faculty, and you can see a total number of people working in our research operations, about 86 really in total. As you look basically to the right, you can see what is the Center for Cardiovascular Regeneration, basically that John really heads up, and the different subcomponents of that. And increasingly, RNA therapeutics, and we'll come back to focus on that basically a little bit further as we go down the line. You can see how the number of clinical trials continue to increase in the Heart and Vascular Center despite COVID. And so that's one of the things that I think we're most proud of, is that the business has gone on despite the fact that COVID has occurred. Sure, there's been some hiccups in the way, but we've learned a lot and we've continued really to run this business. And you can see the value basically of the grants that we're actually bringing in through the Heart and Vascular Center. A few research snapshots really from John, looking at what he thinks are the highlights basically of the research program. Telomere extension rejuvenates the vasculature. I love the quote that he's got in there. A man is only as old as his arteries. And I would think a woman is probably only as old as her arteries too. One of the areas of focus basically on women's cardiovascular health. And so you're only as old as your blood vessels. That's what I continue to tell people. And now we have this amazing armamentarium with what John is doing basically in the lab, all the way up to what Karam is doing basically in the Center for Health and Wellness. You can see basically some of these other highlights that we have here. Novel inflammatory mechanism in atherosclerosis, single cell genomics, dissect human diseases cell by cell, engineering future RNA therapies and RNA successes. And many of our clinicians are working side by side basically with these researchers. And that's one of the things that they want to continue to encourage really basically as we move forward. Really didn't even know what RNA therapeutics was up until a couple of years ago. And now we've built basically a lab that can produce industrial level RNA, and that's really been a function basically of John pushing this. And it's not been easy. I often say these things are like pushing a rock up a hill. As soon as you stop pushing, the rock rolls back and squashes you. But John basically has really pulled this off. And this is basically the team where we believe that RNA therapeutics will transform cardiovascular medicine. And will it? So I wanted to close with this. This is me getting my COVID vaccine, RNA. So John, you're absolutely right. Hopefully this represents freedom, and hopefully this represents basically a liberation that we're going to have basically over the probably the last 6 months of this year. But let me, on behalf of Dr. Zogby and Dr. Koch, say a huge thank you to all the people in the Heart and Vascular Center, not just the physicians, the administration, the nurses, all the techs, the people who clean these rooms have been under tremendous pressure this year. On behalf of myself and those, thank you very, very much for what you've done, and I look forward to an even better 2021. Thank you indeed for your attention today.